Hello, everyone, and welcome to today's session of Ask the Expert in the context of the COVID-19 pandemic. My name is Ashley Baldwin. I work in the communications department at the Pan American Health Organization, and yesterday was World Patient Safety Day. This year's theme for the day is Safe Health Workers, Safe Patients. And we'll see in the speech that we're going to have at the moment, the little chat that we're going to have, that really we can't have one without the other. So just to have a look at some numbers to put us in context, there's 134 million adverse events that occur each year due to unsafe care in hospitals in low and middle income countries. And this results in 2.6 million deaths. Aside from that, 4 out of 10 patients suffer damage in primary and outpatient healthcare, and up to 80% of this is fully preventable. When we look at COVID-19, the pandemic that we're experiencing at the moment, we've seen that while health workers represent less than 3% of the population in most countries, around 14% of cases of COVID-19 actually occur in health personnel. Thousands have lost their lives, and we want to know why these events happen, what we can do to prevent them, and how this situation has really been exacerbated by the COVID-19 pandemic. So I'm joined here today by 3 of my colleagues from the Pan American Health Organization. Benjamin Puertas, who's the Sub-Regional Advisor in Human Resources for Health. Good morning, Benjamin.
Good morning. Hi, how are you?
I'm also joined by Julieta Rodriguez Guzman, who's the Regional Advisor in Occupational Health. Hi, Julieta.
Hi, Ashley. Hi, colleagues. Very pleased to be here with you all. Thank you.
Thank you. And last but certainly not least, I'm joined by Mali Cho, who's Regional Advisor in Human Resources for Health. Hi, Mali.
Hi, Ashley. Good afternoon, everybody. I'm really pleased to be here and to share with you.
And we're delighted that you could all join us. And of course, welcome to our Facebook audience. As per usual, we're here to answer your questions. So if you have any questions whatsoever related to patient safety and the safety of healthcare workers in the context of COVID-19, then please pop them in the comments section below and we will get to them at some point during this chat. But first of all, I have quite a few questions. So we'll start with my questions until they start to come in from the audience. When we talk about the role of medical and nursing students in the context of the COVID-19 response and how they're being protected, can you tell us a little bit about what healthcare systems are doing to ensure the protection of medical and nursing students? Benjamin.
Thank you very much, Ashley. And it's a very important question. As you know, we have shortages of healthcare workers in most of the countries. And some of them, as a measure, have included medical and nursing last year students to support the work of other healthcare professionals. And it has been very important. They have been working as volunteers in call centers, for example. They have been supporting the surveillance and also the health care work in health facilities, hospitals, primary healthcare centers. And I think they have been very important. Something that I have to add is that they must receive the same protection as any other healthcare worker, and that is very important. It doesn't matter if they are students or not, but they need to be protected as anybody.
Brilliant. And why, yesterday, as I mentioned earlier, was World Patient Safety Day. And why is it so important that that day is linked to health worker safety, Julieta?
Well, thank you for this very important question, Ashley. In fact, nobody can give what they don't have. If workers are not healthy and safe, they cannot provide a good service. This is basically the reasoning behind this proposal. In fact, we talk about health worker safety, a priority for patient safety. And this is what the charter that was launched yesterday mentions, exactly because we need to have good health and safety and good working and employment conditions for health workers so that they can deliver properly the service they're requested.
And I just have a little follow-up question to that. I hope you don't mind. So we were looking at the stats at the beginning of this talk, and it said that healthcare workers account for 3% of the population in most countries, and yet they're sort of 14% of those affected by COVID-19. So what's really the implication of us not linking World Patient Safety Day and initiatives such as that to the safety of healthcare workers? What does that mean for us as people who may have to go and receive treatment at some point?
Well, it is very important, and in fact, since this virus is so contagious and so deadly, we need to protect, number one, the persons that are requesting the service because they are under a severe risk of death, as well as the workers. I mean, workers are working with the virus itself and within the patients, and so we need to protect the patients and we need to protect the workers. In a very simple way, this is a disease that can be prevented, or the deaths and the sickness can be prevented as long as we can provide the service timely, the diagnosis is made timely, and both worker and patient are properly secured.
And just following on from that question, I'm going to ask Mali. So we know that the theme for yesterday's World Patient Safety Day is health worker safety, a priority for patient safety. Can you please explain to us why this link, both within the context of the COVID-19 pandemic and much more broadly, because it does go beyond the context of the pandemic, Mali?
Yeah. Thank you very much, Ashley. We consider that the interrelation between patient and between health workers is very close in the sense of it is not possible to take care of patients if there are not health workers. So it's why we need to protect health workers to really protect health safety in patients. So that is why there are this interconnection between health workers and patient safety. Additionally, I want to include some comments in the comments of Benjamin in the sense of why we need to increase the knowledge in students and the last year health career students, putting them in the field because as you know, they don't have enough experiences as the other health workers. So it's very important to reinforce the knowledge and the experiences to share with them to make the follow-up on their implementation of the knowledge that is important to put in place. Thank you.
So really the training of student healthcare workers is so vital because that also has huge implications for patient safety further on down the line. So I guess it all comes back to us a little bit. If we protect our healthcare workers, then we're really ensuring that our health is protected. And of course, we should think about other people, but you know, in the context of a huge pandemic as well, we want to be safe and we want to be healthy. So what do we actually do, Benjamin, to start supporting the safety of healthcare workers?
First of all, follow their indications, follow their advice. Think about you as being users in a hospital. I hope not, but if you are doing so, follow their indications and advice. Think that if you are safe, they are also safe, and that's very important. Understand their role, their responsibilities. Give them your solidarity and show them your appreciation. We were talking before about mental health, and there are many issues and problems with the mental health of healthcare workers because of the pandemic. So even that smile that you can share with a healthcare worker is going to be very important in any situation. So do that.
And are there sort of more practical things that we can be doing? So, you know, we've heard a lot in the context of the pandemic about PPE. I know that Mali was mentioning training of students, nurses and doctors, but I wonder if that applies sort of for people who have already begun their career. And what kind of, you know, when we talk about mental health initiatives and ensuring the mental health of healthcare workers, who of course, you know, are probably those that are among, you know, those that are under the most tremendous stress at the moment, responding to a pandemic, what practically should healthcare systems be looking at to keep healthcare workers safe? Are there a few examples that you'd be able to give us?
Yes, absolutely. The first thing is that we need to have good occupational health and safety programs within the health institutions. This is the starting point. And then, of course, both healthcare workers as well as medical students or any health science student need to learn about occupational health and safety. There is no type of work that is harmless. All types of work in different ways will affect your health. And in this case, and particularly for the healthcare workers and for providing services, we jeopardize our mental health, our physical health, our psychological health, and our social health. And this is what the COVID-19 has shown us. So we need to enforce, I mean, occupational health and safety is not limited to PPE. Occupational health and safety combines a series of sciences like occupational hygiene, like occupational safety, like occupational medicine, like ergonomics, etc. So we need to put all these things in place to ensure that the worker is working in a safe, in a healthy, in a productive way. And this is the first thing we need to do. And this is what hospitals are. This is the reason why we're linking patient safety with worker safety. If the worker cannot be safe and healthy, how can he provide a sick person a service? This is the point. So we need to have healthy, productive, and safe workers.
Thank you so much for clarifying, Julieta. So sorry, Benjamin.
Just to add, I think Malia and Julieta, they mentioned the training, and this is not only of medical or nursing students. Training should be to everyone, all healthcare workers, and not only nurses and physicians, but all people who are in the front line and who are dealing with, in particular, with the response of COVID-19. I think it's very important, we have seen that with the proper training, fear is reduced, and healthcare workers can do their job in a better way, because in many cases they have been exposed to fear. And we have examples in the Caribbean region, for example, where I come from, that in some cases healthcare workers stopped attending and going to the health centers because they were scared. There were not enough PPEs, or fear of getting the virus. So I think training reduces that amount of fear, and it helps you to do your work in a better way.
Brilliant.
Yeah, may I add, additionally to training, I think it's important the implementation of protocols. There are a lot of protocols that were developed during this period of COVID-19, and we know that those are available, but implementation is the other step that is necessary to be done, and the monitoring of this implementation, because it's not just having the protocol on hand, but how to implement, and the follow-up of this monitoring and implementation is very important.
So there's lots of things that I guess governments and ministries of health and healthcare systems can be doing to ensure the safety of healthcare workers. But we've just had a question come in to the chat, and it was, what can members of the public do? So, you know, we've all read in the news the past sort of few months about exhausted healthcare workers that are working on the front line of the COVID-19 pandemic. And some people have been, you know, going and delivering food, and companies have been providing personal hygiene products and things like that. Is there, what do you all think about those kinds of initiatives, firstly? And secondly, is there anything else that members of the public can practically be doing at the moment to support our key workers and particularly our healthcare workers at such a difficult time? It's a question for all of you, so feel free to jump in.
Okay, maybe I can start. I consider that the public, as you know, COVID is not a disease that can be fighted only in hospitals and in ICU care. The main fighting is in the community. So I consider that it's very important for the community to follow the indication of public health, the distancing, the hand hygiene, and the use of masks are very important. That will be the first steps. The second one is, as every human being, us as health workers, we want to be recognized by what we are doing. And I consider that it's very important, the incentive. Those incentives could be economical incentive or non-economical incentive. I know that in many countries in Europe and other countries in the region also follow the recognition, making applause every night to health workers, for instance. That is.
They did that in my country. That's true. That's true, Mali.
One kind of recognition that is important to let them know that we understand, we know how difficult is working in this condition.
Right. Benjamin or Julieta, do you have any suggestions for our members of the public?
I do. I think to the person who wrote the question, that it's very important. I ask you back, what do you do in your life? What you are good? I was a musician before I was a doctor. And during the worst part of the pandemic, I was very concerned. I got a son who got the virus. I got many of my colleagues from medical school who were in the front line getting sick. So I wrote a song and I make a video out of it and I sent to all of them. And actually I asked them for photographs while they were working in the front line. And I included those photographs in the video from doctors, nurses from Ecuador, from where I come from Honduras, from the Caribbean, the places I've been, El Salvador. And I put the music I wrote with the lyrics I was thinking, and it really helped. I received a lot of friends of mine writing me back saying that this really helped, listening to the lyrics, to the music. And I got over 600 visits in the YouTube, so I think more people than just my friends saw that. So do what you do best. If you're a musician, play music to those health workers. If you're a poet, write a poem to them. If you cook rich, tasty things for them. That's what I suggest.
Thank you, Benjamin.
So,
Julieta?
just to compliment, because they have given very good advices, but acknowledging that this is a disease that is highly contagious and highly deadly, and it doesn't respect any age, gender, any social or economic condition. Anybody can acquire it. And this is the first thing we have to be aware, that we are all at risk. Of course, for healthcare workers, the risk is higher because they deal with the disease and the virus itself. But if you want to really support and help healthcare workers, what we need is to have less cases. How do we do that? Protecting our safety and health in the community. Everybody is responsible for their health and safety. And how do we do that? Well, I wear my mask. I wash my hands. I keep my social distance. I do not touch my eyes, and I don't go out, and I don't go to bars and parties. And if I do, I try to do it in the best way so that I can protect myself, because when I protect myself, I protect you.
Thank you so much, everyone. So we have sort of a cornucopia of responses from, utilizing our cooking skills. I certainly won't be poisoning anyone at my local hospital with mine, but it's very true what Julieta said, and it's something that we've been saying throughout these Ask the Expert sessions, right from the very beginning, follow the public health measures that are indicated by your national and local governments, and that might include mask wearing, washing your hands, hand hygiene when you come back into the house, of course, before you eat, and also cough etiquette. So making sure that everyone coughs and sneezes into the corner of their arm or a tissue that's then disposed in a closed bin. So there's lots of things that we can do, and it's true, I think, what Mali was saying about, in Europe where I'm from, certainly at the beginning of the pandemic, people were coming out and they were clapping their hands. For us in the UK, it was every Thursday night at 8 o'clock, clap for the National Health Service. But then if you're not doing the things alongside that Julieta was recommending, then of course we're contributing to cases, which is putting our, very needed, very beloved healthcare workers at risk. Mali, how does health worker safety result in patient safety?
The fact that as I include myself as a health worker, we are safe. We are able to provide safety and care to patients. When we are working in a safe environment, of course, we can take much more attention to the details in the care of the patient, which is not possible if the environment where we are working is not friendly. If we have too many patients in charge, if we have too stressful environment, ambience, if we have to take some ethical or moral decision about taking care or not taking care of patients because we are lacking of infrastructure, of equipment, of consumable. So it is very important really to reinforce the safety of healthcare workers to ensure the safety of patients.
Brilliant. Thank you so much. And you've mentioned, stress and ensuring a, ethical environment as well. What does that mean in the context of a place of work of a healthcare worker? How can we protect their mental health?
There are many different ways to really organize and planning the environment. The shift, the time of working and the resting time is very important to program and to planning. According to experiences in countries in the region and also in the European community, as in Italy, and they decided to shorter the time of working instead of making longer the time. And they decided to make it 6 hours instead of 8 hours. But the situation in our region is the contrary, because we lack enough and sufficient number of health workers. And sometimes we are asking to people to make double time of working. That can be against the safety of patients and the safety of the health workers also, because the possibility of infection is increased.
So we've had another, I guess, comment / question come in on our chat, and it's following on from what can we do to support healthcare workers as members of the public. It was, what about current affairs and how important is it that we also show our support and solidarity for healthcare workers during the pandemic more broadly on social media and traditional media, I guess, as well, would be included within that. Why is it so important that members of the public are vocal? Or do you think that it's important, number one, that members of the public be vocal about how important healthcare workers are and how important ensuring their safety is. And do you think that social and traditional media are good things that we can use to I guess, augment our voices?
This is a very tough question, I would say, because we have also an infodemic. And the infodemics have distortion reality in many cases. So we have to be careful on that too. But I would say that acknowledging and being supportive with either verbally speaking or sending nice messages is a very good way. Also, one of the things that has jeopardized a lot of the health and safety of health workers is violence. And violence, unfortunately, is given also by people. They're fearful because the doctor lives in the 5th floor and he comes and he can bring the COVID he's treating to my building. And so they make things very uncomfortable for these workers. So one of the things is to inform themselves very well. I mean, one of the things we would love to have is people being informed. If he's doing a good job, if he's following the protocols of how to arrive home and not have contagious for anybody, this is good enough. But if you aggress them, and if, I mean, we have people being aggressed, being punched, being shouted at, and this is not healthy for the health workers. They are human beings. They have to come home and visit their families. They have to try to have a normal life as much as possible. So being supportive, controlling aggressiveness and violent acts against them is something to call upon. And this would be a lot of help for these people, because those things affect not only the person's mental health, but also the family and the social group that they belong to. So it is very important to mention that, because we need to have peace of mind to go to work and to return from work.
I have to add something, Ashley. In a country in the Caribbean, I was deployed at the beginning of the pandemic, and healthcare workers, especially nurses, were being stigmatized when they were using public transportation.
Right.
So that became an issue, and it was a very important effort from the government to play with the media, social media, how important it was to be and to show solidarity with those healthcare workers. As a short-term solution, they had to put a special transportation for them, so they wouldn't have to use the public transportation. But then with this media and communication, social media really improved the situation, and nurses started feeling more comfortable. I think those are examples of how important to have good communication and to be able to show that support to the healthcare workers.
Actually, may I just finalize this part saying that this aggression against or violence against a healthcare worker impact also in the patient safety, because don't forget that we cannot forget all the pressure or stress when we are going to work. So it's important to really feel comfortable when we are working, to really provide the safety to patients.
Yeah, that's certainly true. And you've all mentioned a couple of points that I just wanted to expand on a bit. The first was the infodemic that Julieta brought up. And, you know, one thing that we've been plugging throughout these Facebook Lives since the beginning, again, is to, you know, when you're sharing information, particularly on social media, where there's such a deluge of information, much of which is true, much of which is false, it's to think very carefully before you share something. And secondly, you know, if you are looking for reliable sources of information, go onto the PAHO.org website. There's communications tools there which have all sorts of information about healthcare workers, about various aspects of the COVID-19 pandemic. WHO's website is the same. And the Ministry of Health's websites, if you have them in your countries as well, should also have reliable, concise information about what to do, what's true, what's false, what's a rumor, etc., etc. Unfortunately, there's a lot of media outlets as well, particularly the really big ones that are fact-checking articles, which is hugely valuable. So I would encourage everyone to use those resources. Benjamin, we've had a request for you to please post your music video to the chat section so that everyone can see it. And I have a question. I know, Julieta, you mentioned the Charter on Health Worker Safety, a priority for patient safety that was launched yesterday. Can you tell us a little bit about that and who it's aimed at and why that charter is so important?
Well, this charter is extremely important for several reasons. First of all, because workers' health safety is a priority to really deliver services and to protect patient safety. This is the first reason. Now, the second reason is this is a charter that was issued by the WHO and the ILO, and it is and has the purpose exactly to bring together, to establish a real synergy between patient safety and workers' health safety, because we know that we need each other for that purpose. That it also has in the background a very important purpose, and is to invite all countries to organize policies and action plans on occupational health and safety for the health sector. As we've mentioned before earlier, we have had very weak health systems, and one of the weaknesses is not having occupational health and safety programs in place. It jeopardizes both the workers and the services they provide. So this is a second purpose of it. As well, we want to protect health workers from violence at the workplace, improve mental health and psychological well-being of the health workers, and protect health workers from physical and biological hazards. This is the content of the whole charter, acknowledging that these problems have been documented and exist, and that we have to tackle them together. And this is why within PAHO we have had all this joint and collaborative intersectorial and interdepartmental work, because we need from each other to really make this happen. As well, we also have guidelines to make this happen, and a questionnaire to make this happen, and to support with technical assistance all countries, so that we can have this all set up together and have the agenda move forward. In other words, occupational health and safety became very important to really protect health workers in this pandemic situation and in all working situations. And probably I also should mention another very important thing that was related to one of the questions. Who are the healthcare workers? Who are the health workers? It's not only physicians, nurses, and it's from the doorman at the hospital to the manager in the hospital. Everybody inside there. And we have, these are the frontline people, but we have also public health workers that are also in jeopardy with the COVID. For example, ambulance drivers, firemen, policemen, food providers, all those that were mentioned, they are very important, because I mean, people need to live, people need to eat, people need to transport themselves. So all of these workers that are surrounding the service, they become part of the workforce. So we need to protect everybody.
Yeah.
I wanted to add, Ashley, and that is that at least in the region where I come from, none of the countries have declared or recognized COVID-19 as an occupational disease. And that has some implications. I have seen what happens in South America, and it's a different situation. But,
and what does that mean, Benjamin, when you recognize a disease?
I was going to pass along.
Excellent.
To implications of not recognizing COVID-19 as an occupational disease. I'm worried because that's happening. You see healthcare workers getting sick, getting the virus, and what's happening with them, with their families. Countries say, well, we have already a health system, a social security program that can take care of that. But if you don't recognize COVID-19 as an occupational disease, I think there are many and very important implications.
Well, it's a worker's right to be covered in all senses, to be covered by health insurance, by workers' compensation insurance, by pension insurance. And what being diagnosed as an occupational disease means is that I will be protected in all those spheres. I will be attended from the health point of view, but it also means that if I have a medical leave, I will not lose my salary. It also means that if I die, my family will be protected with my pension plan. It also means, so I mean, this is being a big discussion. For example, there are certain countries in the Caribbean particularly that do not have occupational disease definition within their regulations, so they don't recognize it. This is one of the problems we've detected through our work in the Caribbean, and this is very important because this is neglecting the rights of the worker and jeopardizing the life of a family. I mean, if my husband dies and I was depending on his salary, and now I'm a widow with 2 kids and no income, so it implies a lot of things of being diagnosed as an occupational disease.
And for something to be diagnosed as an occupational disease, does it mean that governments have to recognize that healthcare workers are more at risk of a particular disease such as COVID-19 than members of the general public? That it's something that they're picking up in the workplace, that they're more exposed to
working activity. We have to prove 2 things: that there is a damage for the health and that there was an exposure that damaged the health. So in this case, we have the virus, which is in the work environment of the health worker, and we have the damage that it could be the COVID-19 disease. So if we match them together and they are recognized, then the worker has the right to all the coverage and all the benefits that the insurance has for him.
Brilliant. Well, thank you all so much. We're coming to the end of this session of Ask the Expert. I just have one question for all of you, really. And that's, what would you like our audience to take away? What is your main message that you want everyone to keep in mind for World Patient Safety Day this year? And I'll start with, I'm going to put you on the spot, Benjamin. You've given everyone your wonderful song, so now we want some more advice, please.
I think it's important for you, my friends, to understand that you have a role, and a very important one. We have mentioned how you can, just by following some simple procedures such as wearing your mask, maintaining social distance, you are helping healthcare workers. And if you go one step further, you can support them by showing them your solidarity in any way that you can imagine. And let me tell you that this person is going to really appreciate that support. So, and again, respecting, understanding the work of the healthcare worker. So those are the 3 advices I would give to all of you.
Thank you, Benjamin. Julieta?
Well, I would say, I would, adding to Benjamin's advice, I would say, don't forget that we are all human beings and we all deserve respect. We all deserve kindness. We all deserve a good life. And not to forget that if I take care of myself, I take care of you.
Thank you, Julieta. And Mali?
Yeah, I just want to say that all of us, we can become patient. So if we become patient, we want to be safe. And for that, it's very important to protect the safety of healthcare workers to really provide us safety and quality and good care.
Brilliant. Well, thank you all so much. And thank you, our audience, for joining us on World Patient Safety Day, or the day after World Patient Safety Day. We will be back next week, same time, same place, to do another episode of Ask the Expert, where we'll be looking at a different aspect of health in the context of COVID-19. So please join us then. Thank you to Benjamin, Julieta, and Mali for taking the time out of their incredibly busy schedules to join us. We appreciate it. And we'll see you next week, everyone. Bye-bye.
Thank you so much.
Thank you very much.
Okay.